My name is Karen Beck. I just want to do a little introduction video with you guys and kind of show you a little bit about myself. And this is my biggest interest right here is my kids and family. This is my youngest, Eli. He is going to turn 2. He is quite the busy little guy. And then I have Keisha. She's my oldest, turning 13. Andy, who's my little kindergartner. He's very busy. That's a lovely face. Rylan.
Hi.
He is turning 8.
I am turning 8.
And losing his teeth.
And losing my teeth.
And then I have Joni, and she is my 5th grader. And then I have my husband, if he'll show himself real quick. And he is a great help to me, one of my biggest supports. And we live out here in Mendon, Utah. I don't know if you know much about Mendon, but it's on the outskirts of Logan. We own about 5 acres of land. We have a horse, a cow, some chickens, and a little dog that we're still getting used to. I have been a nurse in the ICU for about 17 years. Well, 13 years of it in the ICU, and then I've been a nurse in the medical floor for quite a bit. I love nursing. I love working with the patients. I love just getting to know my patients and what their diagnoses are, and diving into their care. With that being said, it has piqued my interest enough to start to want to work into the nurse practitioner field. So I have decided to go into the nurse practitioner, and I am loving it. I love studying and learning. I love really getting to know my patients better and the things that they can teach me. As far as where I want to end up, I have thought about working in the hospital setting like a nurse practitioner in the hospitalist. I've also thought about working in an emergency room or maybe in an Instacare. I'm not opposed to doing the outpatient practice either. Although I do get a little nervous about the pediatric population because my nursing background, I have not worked a lot with a pediatric background. So that does make me a little nervous. I also, as far as my project goes, that is a hard one. I have a hard time deciding what I want to do, but I have thought a lot about possibly doing something related to educating the patients to prevent readmissions to the hospital. Or what we can do. The other idea that I had was what kind of things I can do with nursing touch. Is there a way that if we incorporate touch into our care, that our patients will have a better relationship and will know that they're cared? Some sort of touch or nonverbal communication that we as providers can do, and how that would affect our patient population. Well, that's a little bit about myself. I just want to show you 2 our mountains back here. We can take our snowmobile and ride right from our backyard all the way up to the mountain. And sometimes we like to pull our kids on the sleds right there and give them a little ride. We love living out in the country, and I look forward to getting to know you guys all too.